All right, so it looks like you've sent us a ton of info on esophageal varices. Seems like you're looking for a clear understanding of this condition, and you're interested in both conventional and alternative approaches. We're here to help you dive deep into all of it.
Yeah, it's great that you're taking such a proactive approach to your health. It's clear you want to understand not only what's happening, but also what you can potentially do about it.
Exactly. So, first things first, let's define what esophageal varices actually are. Imagine a dam causing a river to back up, putting immense pressure on the riverbanks. That's kind of what happens in your body with this condition. When blood flow to your liver is blocked, it creates a similar backup, increasing pressure in the surrounding veins. The ones in your lower esophagus, those are the ones we're talking about, become enlarged and fragile. Those are your esophageal varices.
And that pressure buildup, we call that portal hypertension. So it's most often caused by cirrhosis of the liver. Though any obstruction to blood flow to the liver can cause it, the problem is these engorged veins are prone to bleeding, and that can quickly become a medical emergency.
Okay, that sounds pretty scary, to be honest. So how would you even know if you have this condition? Are there warning signs?
Unfortunately, esophageal varices often don't cause noticeable symptoms until they actually start bleeding, and that's when things can get serious.
So it's a silent threat until it becomes a crisis. What should we be on the lookout for?
Well, imagine your body trying to send you an SOS. That's what these symptoms are. The most alarming is vomiting blood, which could be bright red or look like coffee grounds. You might also see black hairy stools, indicating bleeding higher up in the digestive tract.
Okay, that's definitely not something you'd want to ignore. Anything else?
You might also experience a sudden drop in blood pressure,
Mm.
leading to weakness, faintness, or even fainting. Sometimes there's abdominal pain, though not always. Any of these symptoms, especially in combination, warrant immediate medical attention. Don't wait.
Got it. Those are red flags we can't miss. So how do doctors actually diagnose this? They can't exactly see those veins from the outside.
That's where an upper endoscopy comes in. It's a procedure where a thin, flexible tube with a camera is inserted through your mouth and down into your esophagus and stomach. This allows the doctor to directly visualize the varices and assess their severity.
Makes sense. See it to believe it, right? Are there other tests as well?
Of course, blood tests are usually done to check liver function and look for signs of anemia, which can indicate bleeding. Imaging techniques like CT scans or ultrasounds might also be used to get a more detailed look at the liver and its surrounding blood vessels.
So once esophageal varices are diagnosed, what are the treatment options?
The main goals are to prevent or control bleeding and reduce the pressure in the portal vein. There are various approaches, and the choice depends on the individual case. Let's start with some of the conventional medical treatments.
Okay, walk us through those.
One common procedure is called endoscopic banding. During an endoscopy, the doctor places tiny rubber bands around the varices to cut off their blood supply, essentially shrinking them and preventing bleeding.
Wouldn't cutting off the blood supply completely damage the esophagus?
That's a good question. The bands are placed very carefully to target the varices specifically, minimizing damage to the surrounding esophageal tissue.
Okay, that makes sense. So what else is there?
Medications are another key part of treatment. Beta blockers like propranolol or nadolol are often prescribed. They're typically used to lower blood pressure, but in this case they help lower pressure in the portal vein as well. Another medication, octreotide, is sometimes used in emergencies to quickly decrease blood flow to the varices if they're actively bleeding.
So it's a two-pronged approach. Medications for ongoing management and then octreotide as a sort of emergency brake when needed.
You got it. There's also injection sclerotherapy, which involves injecting a chemical solution into the varices to close them off.
Sounds like there are a lot of ways to address those varices directly.
There are. And for more complex cases, a procedure called a transjugular intrahepatic portosystemic shunt, or TPS, might be an option. This involves creating a new pathway for blood to flow from the portal vein to another vein, bypassing the liver and reducing pressure. And of course, in the most severe cases of liver cirrhosis, a liver transplant might be considered.
Wow, that's quite a range of options.
It really highlights the importance of early diagnosis and management. The sooner you catch this condition, the more options you have, and the better the potential outcomes.
Absolutely. Now, we know you're also interested in exploring alternative therapies. I'm really intrigued by this part, to be honest, because your research brought up some unique ideas.
It's great that you're open to exploring different approaches. It's important to remember, though, that these alternative therapies should be seen as potential complements to not replacements for conventional medical care.
Right. Always good to emphasize that. So with that said, let's delve into the two you were specifically curious about. Fasting and the use of honey, particularly Manuka honey. Fasting as a therapeutic approach is gaining popularity for a variety of health concerns. But I'm curious, how does it apply to esophageal varices specifically?
Well, to understand that, we need to talk about autophagy, a process your body uses to clean up damaged cells and recycle their components. Fasting actually stimulates autophagy, which can be incredibly beneficial for your liver.
So it's like giving your liver a deep clean.
Exactly.
Hmm.
This cleaning process can help improve liver function, reduce fat stored in the liver, and ultimately ease pressure on that portal vein. In one study from your research, they found that intermittent fasting led to a significant reduction in liver fat, which is directly related to portal hypertension.
That's fascinating. So it's not just about shrinking the varices directly, but improving overall liver health to address the root cause. What types of fasting are we talking about here? Is it like not eating for days on end?
Not necessarily. Intermittent fasting, where you restrict your eating window to a specific period each day, seems to be particularly promising. The 168 approach, where you fast for 16 hours and eat within an 8-hour window, is a good example. This study we just mentioned actually used that approach and saw great results.
Okay, so it's more about strategic timing than total deprivation. Now, I have to admit, Manuka honey for esophageal varices, that's not something I'd heard of before. I'm definitely curious to learn more.
Honey has been used medicinally for centuries, and Manuka honey in particular has some unique properties. It's sourced from the Manuka tree in New Zealand and contains high levels of a compound called methylglycol, or MgO. MgO is a potent antibacterial and anti-inflammatory agent.
So it's honey with a super boost, but how does it relate to esophageal varices specifically?
Your research actually included a study where Manuka honey was shown to reduce inflammation in the esophagus, even more so than conventional medications in some cases. This is likely due to its high MgO content, and it suggests that it could potentially help soothe the irritation and discomfort caused by esophageal varices.
Okay, I'm starting to see the connection now. It's not necessarily about shrinking those veins directly, but about managing the symptoms and supporting the healing process. Are there other ways Manuka honey could be beneficial in this context?
It's also been shown to have a protective effect on the stomach lining, which is constantly exposed to stomach acid and can be damaged in cases of esophageal varices, especially if there's been bleeding. Manuka honey's thick, viscous texture helps coat and soothe the esophageal lining, kind of like a natural bandage.
That makes sense. It sounds like Manuka honey has a lot to offer, but I know there are a lot of different types of honey out there. How can you be sure you're getting the real deal, the kind with those high levels of MgO?
That's a great question. Not all honey is created equal. You want to look for the UMF rating on the label. UMF stands for unique Manuka factor, and it indicates the level of MgO and other key compounds in the honey. The higher the UMF rating, the more potent the honey. Anything above 10 is considered therapeutic grade.
Good to know. I'm already making a note to check my honey labels now.
It's always good to be an informed consumer. We've covered a lot of ground already in this first part of our deep dive. We've talked about the causes, symptoms, and conventional medical treatments for esophageal varices. We've also started to explore some fascinating alternative therapies, like fasting and Manuka honey, and how they might play a role in managing this condition. But we're not done yet.
I'm already hooked. There's so much more to explore. Stay tuned for part 2 of this deep dive where we'll continue to uncover the fascinating world of esophageal varices and how to manage them.
Welcome back to our deep dive into esophageal varices. We've already covered a lot of ground, but there's still so much more to explore. It's fascinating how your research materials delve into both conventional and alternative approaches, showing a real desire to understand the full spectrum of options.
Yeah, it's amazing how much we've learned already and we're just getting started. I have to admit, I'm particularly intrigued by this whole concept of fasting for liver health. It seems counterintuitive, but the science is really compelling. In the first part, we talked about how fasting can trigger autophagy and help clean up the liver. But I'm curious, are there specific types of fasting that are considered more beneficial for liver health and potentially for managing esophageal varices?
You're right to ask that. Not all fasting is created equal. While more research is needed to definitively say which type is most effective for this specific condition, intermittent fasting has shown real promise. It's a more sustainable approach than prolonged fasting and has been shown to improve liver function and reduce fat accumulation in the liver.
And that reduction in liver fat is key because it directly impacts that pressure in the portal vein, right? Less fat, less pressure, healthier veins.
Precisely. It's all connected. Now, within the world of intermittent fasting, there are a few variations. One that's become quite popular is the 168 method, which we touched on earlier. You fast for 16 hours each day and eat within an 8-hour window. Another option is alternate day fasting, where you eat normally one day and then severely restrict calories the next.
Wow. Alternate day fasting sounds pretty intense. I can see how that could be a challenge for some people.
It definitely takes some discipline, and it's not right for everyone, especially those with certain medical conditions. But there's growing evidence that this type of fasting can be very beneficial for liver health. It seems to be particularly effective at reducing inflammation and promoting cellular repair in the liver, which are both crucial for managing conditions like esophageal varices.
Okay. So it's not just about reducing pressure on those veins, but also about helping the liver heal itself. It's like a two-for-one benefit. But I imagine it's important to do this kind of fasting safely, especially with a serious condition like esophageal varices. What advice would you give to someone considering this approach?
My advice would be to start slowly and listen to your body. Maybe begin with a shorter fasting window, like 12 hours, and gradually increase it as you feel comfortable. And of course, it's absolutely crucial to consult with your doctor before making any major changes to your diet, especially if you have a pre-existing medical condition. They can help you determine if fasting is safe for you and guide you through the process.
Absolutely. Safety first, always. Now, I want to circle back to Manuka honey because I'm still fascinated by its potential in this context. We've discussed its anti-inflammatory and antibacterial properties and how it might help soothe the esophagus and protect the stomach lining. But I'm curious, is there any evidence to suggest that Manuka honey can actually impact the liver itself?
That's a great question, and there's actually some promising research in this area. A study published in the Journal of Medicinal Food found that Manuka honey exhibited significant hepatoprotective effects in rats with liver damage. It seems to work by reducing oxidative stress and inflammation, which are two key drivers of liver disease.
So it's not just about managing the symptoms of esophageal varices, but potentially about protecting the liver from further damage. That could be a game changer for people with cirrhosis or other liver conditions.
Exactly. And while more research is needed to fully understand the mechanisms at play, these findings suggest that Manuka honey could be a valuable addition to a comprehensive approach to liver health.
It's incredible to think that something as simple as honey could have such a profound impact on the body. It really speaks to the power of nature and the potential of these natural remedies, but I know that not all honey is created equal. We talked about the importance of the UMF rating, but are there other things to look for when choosing Manuka honey?
You're right, quality matters. Look for honey that's raw and unpasteurized, as heat can destroy some of its beneficial compounds.
Mm.
Also, check the label to ensure that it's 100% pure Manuka honey, sourced from New Zealand. Some products might be blended with other types of honey, which dilutes the potency.
So it's all about being a savvy shopper and reading those labels carefully.
Absolutely. And when it comes to dosage, starting with a teaspoon a day is a good guideline, but it's always best to consult with your doctor to determine the appropriate amount for your individual needs.
Okay, that makes sense. It's clear that both fasting and Manuka honey have a lot to offer in terms of supporting liver health and potentially managing esophageal varices. But I imagine that incorporating these approaches into your life can be a bit daunting. Where would you recommend someone even begin?
That's a great question. One of the simplest ways to start is by incorporating Manuka honey into your daily routine. You can have a teaspoon on an empty stomach each morning, or mix it with lukewarm water for a soothing drink. As for fasting, begin with a shorter fasting window, like 12 hours, and gradually increase it as you feel comfortable. Remember, slow and steady wins the race.
Great advice. And of course, we can't stress enough the importance of working with your healthcare provider to create a plan that's safe and effective for you. They can help you navigate these approaches and ensure you're getting the most benefit.
Exactly. It's all about a personalized approach. What works for one person might not work for another. That's why open communication with your doctor is so important.
We've explored a lot of fascinating information in this second part of our deep dive, from the nuances of intermittent fasting to the potential benefits of Manuka honey for liver health. But I can tell there's still more to uncover.
You're right. We're not done yet. There are still some key insights to share, and we want to make sure you leave this deep dive feeling empowered and informed.
Stay tuned for part 3, where we'll bring all of this information together and leave you with some final thoughts and takeaways to help you navigate your health journey.
Welcome back to the final part of our deep dive into esophageal varices. It's been quite a journey, hasn't it? We've gone from understanding what esophageal varices are to exploring an array of treatment options, both conventional and alternative.
Yeah, it's amazing how much information we've unpacked, and I'm particularly impressed with the depth of your research. You've really dug deep into this topic, and it's clear you're committed to taking control of your health. Absolutely. But with so much information out there, it can be hard to know where to start. So in this final part, I want to make sure we connect all the dots and leave you with some actionable takeaways.
Okay, that's a great idea. Let's distill all this knowledge into something practical and empowering.
Okay, so first things first, why should someone even care about esophageal varices? It's not exactly a household term.
Right, you're right. It's not something that's talked about very often,
Yeah.
but it's a serious condition that can have life-threatening consequences, especially if it's not detected and managed properly. And while it's often associated with cirrhosis of the liver, it's important to remember that any condition that disrupts blood flow to the liver can potentially lead to esophageal varices.
That's a good point. It's not just about alcohol consumption, though. That's certainly a major risk factor. Hepatitis, fatty liver disease, even certain genetic conditions, these can all damage the liver and increase the risk.
Exactly. So awareness is key. If you have any known liver condition, even if you're not experiencing any symptoms, it's crucial to have regular checkups and discuss the possibility of esophageal varices with your doctor. Early detection is vital.
Early detection, that's a recurring theme here. And it makes sense. The earlier you catch this condition, the more options you have and the better your chances of preventing complications. Speaking of complications, let's talk about what happens when esophageal varices actually start bleeding. That's when things get really scary.
Unfortunately, yes. Bleeding from esophageal varices can be a medical emergency. It can lead to significant blood loss, anemia, shock, and even death if it's not treated promptly.
So knowing the warning signs is crucial, as we discussed earlier. Vomiting blood, black tarry stools, sudden weakness or fainting, those are all red flags that you need immediate medical attention.
Absolutely. Don't hesitate to call for help if you experience any of these symptoms. Time is of the essence in these situations.
Now let's shift gears and talk about what you can actually do to manage this condition. We've explored a wide range of treatment options, from those tiny rubber bands used in endoscopic banding to medications like beta blockers that help reduce pressure in the portal vein.
And don't forget about procedures like TPS, which creates a new pathway for blood flow, and of course liver transplantation, which is a last resort but can be life-saving for those with severe liver damage.
Yeah, it's amazing how far medical science has come in developing these treatments. But what I find particularly fascinating is the growing body of evidence supporting the role of lifestyle modifications and alternative therapies in managing esophageal varices.
You're right, that's where things get really interesting. We've talked extensively about fasting and how it can stimulate autophagy, reduce liver fat, and lower pressure in the portal vein. We've also discussed the unique properties of Manuka honey and its potential to soothe inflammation, protect the stomach lining, and even support liver health.
And those are just two examples. Your research materials also touch on other lifestyle factors that can play a role, such as maintaining a healthy weight, managing stress levels, and avoiding alcohol and other substances that can damage the liver.
Exactly. It's all about taking a holistic approach, addressing the underlying causes of esophageal varices while also managing the symptoms and preventing complications.
So what's the takeaway message here? What do we want listeners to walk away with?
I think the most important message is this. Esophageal varices are a serious condition, but they are manageable. Knowledge is power, and understanding this condition is the first step towards taking control of your health.
I love that. Knowledge is power. We've given you the tools to understand what esophageal varices are, what causes them, how they're diagnosed, and the range of treatment options available. Now it's up to you to take this information and have a proactive conversation with your healthcare provider. Ask questions, explore your options, and create a plan that's right for you.
And remember, you are not alone on this journey. There are resources available to support you and a whole community of healthcare professionals dedicated to helping you manage this condition.
Yeah, I think that's a great note to end on. A message of hope and empowerment. We've only scratched the surface here, but hopefully this deep dive has given you a solid foundation and sparked your curiosity to learn even more. Keep asking questions, keep exploring, and most importantly, keep advocating for your health.
It's been a pleasure diving deep with you.
Thanks for joining us on this fascinating exploration of esophageal varices. Until next time, keep diving deep.